provided information about Vibrio cholerae and Vibrio vulnificus, each with 5 answer choices and explanations for correct and incorrect options. Question 1. Mechanism of diarrhea, Vibrio cholerae. A 26-year-old man returns from a mission trip to rural India with severe watery diarrhea described as rice water stools. He is a febrile, but dehydrated. Stool cultures grow a gram-negative, comma-shaped, oxidase-positive organism that grows well in alkaline media. Which of the following best describes the pathophysiologic mechanism of this organism's toxin? A. Inactivation of EF2 via ADP ribosylation. B. Activation of adenylate cyclase via GS protein. C. Guanylate cyclase activation via heat-stable toxin. D. Destruction of enterocytes via Shiga-like toxin. E. Inhibition of enzyme C-alphan's absorption at the villi. Correct answer B. Activation of adenylate cyclase vs protein. Explanation: Vibrio cholerae produces a cholera toxin that permanently activates GS, leading to increased SCIAMP in enterocytes. This causes chloride and water secretion into the intestinal lumen, producing profuse rice water diarrhea. It's acid-labile, so a large inoculum is needed unless gastric acid is compromised. Why not the others? A. Inactivation of EF2. This is the mechanism of diphtheria toxin and Pseudomonas exotoxin A. C. Guanylate cyclase activation, caused by heat-stable toxin of ETEC, not cholera. D. Shiga-like toxin, associated with EHEC, causing bloody diarrhea and not watery diarrhea. E. Inhibition of NMICL, seen in some bacterial infections but not the primary mechanism in cholera. Question 2. Skin and soft tissue infections, Vibrio vulnificus. A 58-year-old man with a history of cirrhosis presents to the emergency department with rapidly progressing pain, redness, and swelling of his left leg. He reports a recent fishing trip during which he sustained a minor cut while wading in coastal waters. Examination reveals signs of cellulitis with bullae, and blood cultures grow a gram-negative rod. Which of the following organisms is most likely responsible for this condition? A. Vibrio vulnificus. B. Pseudomonas aeruginosa. C. Streptococcus pyogenes. D. E. Bacillus cereus. Correct answer: A. Vibrio vulnificus. Explanation: Vibrio vulnificus is a gram-negative marine bacterium that can cause necrotizing wound infections or septicemia, especially in people with chronic liver disease or iron overload, e.g., hemochromatosis. Entry through skin trauma during exposure to contaminated seawater can lead to rapidly progressive cellulitis and sepsis, requiring surgical debridement. Why not the others? B. Pseudomonas aeruginosa can cause wound infections in moist environments, e.g. hot tubs, but not classically linked to marine injuries or iron overload risk. C. Streptococcus pyogenes causes necrotizing fasciitis, but typically not associated with marine exposure or liver disease. D. Clostridium perfringens causes gas gangrene, often after trauma or surgery, not marine exposure. E. Bacillus cereus, known for food poisoning, not soft tissue infections. Let me know if